Imagine a patient sitting in your clinic. They are profoundly exhausted, their body entirely lacking tension. Heavy, glistening beads of sweat are pouring off their skin, and flies are literally swarming around them. But when you ask how they feel, they look up and say, "Fantastic." Heavy sweating and daytime lethargy typically leave a patient groggy, dehydrated, and miserable. Under normal physiological conditions, a nap usually results in waking up feeling worse. While typical sickness follows a predictable downward decline, symptoms that contradict biological logic create a diagnostic divergence. Homeopathy prioritizes these moments where the body's reaction defies the expected path, treating the contradiction itself as the primary data point. This specific cluster of inverted reactions belongs to a profile known as Clammy Cal. In the homeopathic Materia Medica, this state is associated with the remedy Caladium Seguinum, commonly known as dumb cane. Diagnosis follows the map of these bizarre physical reactions to locate a corresponding substance in nature. Finding the match requires identifying the specific way the body's responses have been turned upside down. The fly attraction stems from a chemical shift in the body. The patient's perspiration is literally sweet-smelling. The sweat acts as a magnet, drawing in insects the same way a blooming flower or spilled honey would. Then there are the tactile hallucinations. The patient complains of a distinct, irritating sensation across their cheeks and forehead, as if a spider web or a thin layer of plaster is tightly stuck to their skin. Their hearing is equally miscalibrated. They develop extreme auditory sensitivity, where the absolute slightest ambient noise causes them to violently startle awake from a deep sleep. These external sensory processes are essentially misfiring. Normal environmental stimuli, the moisture of their own sweat, the feeling of their skin, and standard background noise become sources of intense irritation. This exhaustion extends to the reproductive system. For male patients, the genitalia become flaccid and cold to the touch. They experience impotence and nocturnal emissions that occur completely independent of sexual dreams or mental excitement. The female presentation offers a different intensity. Women with this profile suffer from violent pruritus, a severe, chronic itching of the vulva. The irritation is so extreme it can induce nymphomania, occasionally triggered by the physical migration of parasitic worms from the rectum into the vaginal tract. This diagram of the human torso illustrates a temperature clash. While the reproductive organs are locked in an icy, flaccid blue, the stomach region above it glows an agitated, fiery red. The patient feels as though their stomach is packed with dry food, radiating intense, burning pain. Here is the internal paradox. Despite having a throat and stomach that feel like they are actively on fire, the patient has a severe, unyielding aversion to drinking cold water. The body rejects the exact cooling element that standard logic dictates would extinguish the fire. It is a state of physiological rebellion against the most obvious relief. The profile also includes a respiratory crisis, known as catarrhal asthma. This is characterized by thick, heavy mucus trapped deep in the chest, making every breath a struggle. The relief is immediate but highly specific. The asthma breaks the exact moment the patient manages to cough up even a tiny amount of that trapped mucus. This balancing scale illustrates skin-lung suppression. It shows how a disease state physically moves between the internal organs and the external boundary of the body. Notice the trade-off. When a burning, itchy rash appears on the surface of the skin, the patient's internal lungs clear, and they can breathe perfectly. But if the rash vanishes or is suppressed by topical treatments, the scale tips back, the skin clears, and the suffocating asthma violently returns. The underlying exhaustion isn't disappearing, it is merely migrating. The body trades a lethal internal respiratory crisis for a survivable external skin condition. Beneath these shifting symptoms is a constant baseline of profound bodily relaxation, a heavy, gluey mood, and an urgent morning desire to pass scanty, clay-colored stool. This silhouette maps the complete Clammy Cal profile: sweet-smelling sweat, cold reproductive organs, a burning stomach avoiding cold water, and asthma alternating with a rash. Practitioners view these distinct anomalies as a singular, cohesive signature of a specific internal state. These seemingly unrelated symptoms are the necessary indicators of the patient's condition. The profile of Caladium Seguinum matches this configuration of extreme physical exhaustion and sensory inversion point for point. Within this framework, healing is a process of precise identification, aligning a remedy with the peculiar and contradictory nature of an individual's suffering.